So people want to know if the genicular artery embolization procedure or the GAE procedure for knee pain is going to be covered by their insurance. It's a very reasonable question to ask, especially when you're going to the doctor's office. You always want to make sure as a patient that you ask this question because you don't want to have a surprise in the mail, a few months later stating that you're going to have to pay for everything. The good news is that this procedure is covered, and it's covered by all the major insurance carriers, including Medicare. Now let's talk a little bit about how Medicare makes a decision to pay for any kind of procedure or surgery. Of course, not all procedures and all surgeries that are offered are going to be covered, like massage therapy and acupuncture are usually not covered. So Medicare actually, before they decide whether they're going to pay for any kind of treatment, they have their own independent research with their own experts, making sure that the procedure actually has a high level of research, that it actually works, and it's going to create a real benefit for their patient. And the GAE is one of these types of procedures. The amount of research that's already available telling us that the procedure actually works, there's a definite indication for it, is where Medicare has made the determination and issued codes that now cover the procedure for certain indications. Now, having said that, once Medicare starts to look at this, then the private insurance companies, it becomes kind of a no-brainer for them. Now, they have an incentive in covering these types of procedures, especially the GAE procedure. Not only does the procedure work and it eliminates the patient's pain so that they're not getting further treatments, right? The insurance companies are always looking to make sure that they're reducing their costs while maintaining and driving good value for their beneficiaries. And in this case, it's the elimination of pain. They also are looking at if this procedure can eliminate further costs, like a major knee replacement or continued physical therapy, or even the use for pain medication, all of which insurance companies have to pay for all of these things. If the therapies are not working, the cost continues. So they do a thorough evaluation, and they are looking at what is going to be the best value in terms of, the biggest bang for their dollar. And this is why the GAE type of procedure is something that insurance companies are very interested in looking at, because it's a procedure that not only works, but it is cost effective, right? Because the procedure doesn't involve major anesthesia, doesn't involve having to go to a hospital, having hospital stay visit, preoperative care costs, postoperative care costs, anesthesia costs. These are all things that are baked into the overall cost of what an insurance company has to pay. When it comes to the genicular artery embolization procedure, it's done as an outpatient. It's usually done in a physician office type setting. All we do is actually start a little IV. It's all done with the use of an x-ray camera. The supply cost doesn't include the cost of very expensive hardware. In the case of a knee replacement, that's thousands and thousands of dollars in just hardware costs that can all be avoided in this type of a procedure. The procedure is done within a half hour to an hour. Patients go home the same day. And then post-operative care complications are so low in this procedure that it's a really good value from a financial perspective for an insurance company. And so you'll find that insurance companies actually are moving towards wanting their patients to consider treatment options such as the genicular artery embolization, which not only solves the patient's pain problem, but is a great deal when it comes to the financial side for an insurance company. In any event, as a patient, you should always strive to learn more about the dynamics of if something's going to get covered and what the costs are going to be. Feel free to call our office. We'll be happy to explain and go over this in more detail with you, or make an appointment. One of our specialists would be happy to sit down with you and explain how all this kind of works. So with that, I'll say good luck, especially with your knee pain, and encouraging you to continue staying an advocate for your own care, especially when it comes to insurance coverage. Take care.